Staying in Asia, China, more on China and COVID. The World Health Organization said today that it believes that China is undercounting the COVID cases. Is that an assessment that the United States agrees with? And a little bit more broadly, how do you assess the role of the World Health Organization? The previous administration was not especially happy with WHO's performance at the start of COVID-19 and the start of the pandemic. How do you assess how the WHO is handling it?
Sure. The CDC, I should say, when it announced the pre-departure COVID testing requirement for travelers coming from the PRC, made a couple points. The CDC recommended this approach because of the spread of COVID within the PRC, the prevalence of COVID within the PRC, but also because of the lack of adequate and transparent epidemiological and viral genomic sequence data being reported from the PRC. It's the lack of transparency that has compounded our concern for the potential for a variant to emerge in the PRC and potentially to spread well beyond its borders. We are not going to characterize discussions between the PRC and the WHO. Those discussions took place yesterday. Senior WHO officials have, over the course of the day, characterized not only those discussions, but their assessment of what they have seen, but more appropriately, what they have not seen from the PRC. We've seen the statement from the WHO's emergencies director that the current numbers being published from China underrepresent the true impact of the disease in terms of hospital admissions, in terms of ICU admissions, particularly in terms of deaths. I believe the same official went on to say that we still do not have complete data. That, of course, is the WHO's assessment. They are in the best position to make an assessment because PRC officials recently took part in discussions with them, discussions that included a formal presentation. When it comes to the WHO is an indispensable organization. It is an organization that is at all times important. It is especially important in the midst of what still continues to be a pandemic that is having implications the world over, not only in terms of illness and death, but in terms of the knock-on effects, the economic effects, the inflationary pressures, the supply chain disruptions as well. This is an organization that, at its best, can be effective in terms of the response. Just as importantly, it can be extraordinarily useful in terms of building up resilience so that the world can be prepared for the emergence of the next outbreak, hopefully staunching it before it becomes an epidemic or, at worst, a pandemic. They're, like all organizations, of course, we believe it is possible to optimize its operations. From the earliest day, literally, of this administration, we re-engaged with the WHO out of the knowledge of its indispensability, but also out of the belief that through re-engagement, we could help the WHO in its efforts to fulfill its important mandate.
Just to follow up on that, tomorrow the restrictions for travelers coming from China go into effect in the U.S. So could you just speak to how those restrictions are part of an effort to keep out any potential new COVID variants or detect any potential COVID variants from coming to the U.S.?
Well, this is really a better question for the CDC. They are the ones that are administering this approach. They were the ones that announced it. Of course, this was an approach that is based on science, is based on the best medical advice that emanates from the CDC and its peer organizations. So I'm hesitant to delve too far into this. But the point we've made repeatedly is that when COVID is spreading anywhere, but especially when COVID is spreading with such prevalence in a country as populous and as large as China, of course, there is the potential for variants to emerge. We have seen variants emerge, apparently from other regions of the world that have ultimately reached the United States. This is a transnational, all public health threats are, by their very definition, transnational. We want to do all we can to see to it that the PRC gets this under control and to put in place prudent steps so that we do everything we can to prevent the spread of any potential variants should they emerge beyond any country's borders.
And can I just ask you